When we think about health, we tend to think about health of individuals. Doctor gives us diagnosis, and we treat the illness. When we change our point of view and takes a broader perspective of population health, a more complex story reveals itself. Take New Jersey, for example. It is one of the wealthiest states in the entire nation, but also ranked one of the worst in terms of health disparities. Trenton residents have an average life expectancy of 73 years, but just 13 miles away, in Princeton, that number jumps to 87 years. That is 14 more years of life. That is a huge inequity. And here at the Institute for Health, we're working to get to why. The mission of Institute for Health is to become a national leader in sustainable community engagement, innovative education and training, as well as interdisciplinary and translational scientific research. If we're studying and doing research, it's only meaningful if it's meaningful to our community. It's only meaningful to our population. And in many ways, our community can give us much more directions on how to do research better.
If population research is designed for the community, and the community is not involved, the idea is that some parts or some members of the community are going to be lost in the process, and that's going to be a very big deficit to the body of knowledge that's generated.
New Jersey is made up of so many diverse communities. Every community has their own values and customs and foods even. And so why would health be the same across the board? We know that health is different.
Disparities are certainly one of the challenges that we face. New Jersey is a very wealthy state, and in general, our health outcomes are very favorable, but not for everybody. Equity means that we identify what individual needs are, not that everybody gets the same thing, but that they get what they need.
So I think as we look at things, as we think about the pandemic and what we needed around that, as we think about the water crises that happen in different parts of the state, again, I mean, there's a role that Rutgers and the Institute can fulfill by being able to work with communities, not just doing to them, but working with them to help them have the information they need to really make things healthier in their communities.
The real key to it all is engagement. It really is. It's engaging with people that are closest to the issues, is engaging with partners that can do something about those issues, is engaging with funders that can allocate resources and empower organizations and really get the work that's needed out in the street.
So the process of translating research into policy occurs sort of across the whole research process. Listening from the beginning, formulating questions with the input of those who are affected, potentially affected by the policy, those who make the policy.
One of the things that was unique about the Institute was not just that you're bringing people from different disciplines within under one roof, but that you're sort of consciously rewarding that kind of work that takes seriously the need to truly bring the multiple methods from different disciplines, the multiple data sources, to understand how all these systems work.
You know, how would a mathematician think about solving violence prevention to how would a sociologist, anthropologist, and historian think about history of violence? At the Institute, we pride ourselves in working not only with the research scientific community, but also with private funders and development. And the generous gifts given to us have helped us support countless faculty, research, staff development, leadership development. All of those are important ingredients to have a truly well-rounded institute.
What we've learned is that when we team up, when we bring together assets, when we leverage those assets, that's when we can really get somewhere.
Many aspects of IFA's research over the last 3 decades have helped to impact not only state law, federal law, formation of ACA, some of the citations and Supreme Court arguments, and that's incredibly impactful. And to combine the theory-based research and applicability, really, I think what distinguishes more so than any of the institutes in the country.